fertility concerns? Be your own advocate.
Ma'am, I have a PCOS.
Ma'am, I have a low sperm count.
May ire-recommend ako sa inyo, ma'am and sir. In vitro fertilization are also known as IVF.
Infertility is defined as the inability to become pregnant after 1 year of unprotected sex for women under 35 and 6 months for women 35 and older. So we have 3 stages in the IVF process. 1. Follicle aspiration. 2. Fertilization. And 3. Embryo transfer. Follicle aspiration. This is the first stage of the IVF process in which the eggs are harvested from the ovaries by first viewing them with the help of an ultrasound probe. Each ovary consists of follicles, which are fluid-filled sacs containing the eggs needing to be collected. This is done through the insertion of a long, thin needle into and through the vaginal wall guided into the ovary. A suction device is then connected to the needle, allowing the collection of the desired egg from inside the follicles. Fertilization. In this stage, the eggs collected are immediately transferred to a laboratory, where the healthiest ones are mixed with several sperm through a process known as insemination, or through the direct injection of a sperm into the selected egg, a process known as intracytoplasmic sperm injection. The fertilized eggs are then monitored for 3 to 5 days to ensure growth. A hole is then created in a portion of the zona pellucida to allow the selected embryo to implant successfully into the wall of the uterus. Embryo transfer. Some of the developing embryos are immediately transferred to the uterus, while the rest are frozen and stored for the future use. During the embryo transfer, a speculum is inserted into the woman's vagina so that the doctor can see the cervix. A syringe is then filled with fluid containing one or more of the hatred embryos, which is then attached to a special catheter, which is inserted into the vagina and cervix to reach the uterus. Once inside the uterus, the embryos are injected, after which the catheter and speculum are removed, and the woman is requested to lie on her back for at least 15 minutes. For short, during the multi-step procedure, the mature eggs are retrieved to the ovary and fertilized in a sperm in the petri dish. It takes a few days for the fertilized eggs to develop into embryos. Within a week, an embryo can be transferred into a uterus in hopes to start a successful pregnancy.
Masaya pa kami sa resulta ngayon. 35 weeks na po siya. At kompleto po na sa prenatal. Hinintay lang po namin siya lumabas.